Hello, today we're discussing value-based purchasing for ambulatory surgical center quality reporting, also known as ASCQR. The purpose of this video is to educate allied healthcare professionals about value-based purchasing, goals, measures, reporting requirements, incentive and penalties, and how quality of care in the U.S. is impacted. Today's learning objectives is to examine the measures, reporting requirements, and their methods. First, let's discuss what is VBP. VBP stands for Value-Based Purchasing, which is a program through the Centers for Medicare and Medicaid Services initiative that rewards acute care hospitals with incentive payments for the quality of care they provide to Medicare beneficiaries and based on the quality of care they deliver. The program adjusts payments to hospitals under the Inpatient Prospective Payment System, which is also known as IPPS. This form of payment holds healthcare providers accountable for the cost and quality of care they provide, reducing inappropriate care, identifying and rewarding the best performing providers. The goals of CMS is to seek and develop a comprehensive set of quality measures to be available for widespread use for making informed decisions and quality improvement in the ambulatory surgical center setting. The ASCQR program aims to promote higher quality and more efficient healthcare for Medicare beneficiaries through data reporting, quality improvement, and measure alignment with other clinical care settings. What are measures? Measures is an initiative that identifies the highest priorities for quality measurement and improvement. It involves assessing the core issues that are critical to providing high quality care and improving individual outcomes. ASCQR measures payments determinations based upon endoscopy and polyp surveillances, cataracts, facility 7-day risks, normothermia, as well as any voluntary measures. In order to meet reporting requirements and to receive full payment updates, ASCs must meet data collection and submission requirements. A Quality Net Security Officer will have to be designated to submit documentation for a Quality Net account at www.qualitynet.org 4 to 6 weeks prior to any quality measure data submission deadline. The Security Administrator will be responsible for reporting web-based measure data via using the web-based tool and will also be available for submission reports. If CMS determines that the ASC did not meet the ASCQR program requirements for the calendar year, the ASC may submit a request for reconsideration to CMS. The request may identify the ASC's specific reason for believing it did not meet the annual payment update requirements and why they should receive full APU. ASCs that meet program requirements during a given calendar year receive their full payment update for the upcoming calendar year. ASCs that do not participate or fail to meet those requirements may receive a 2% reduction of their payment update. To participate, an ASC submits quality measure data, and once ASC submits any quality measure data under ASCQR program, the ASC is considered participating in the program. Calculations for value-based purchasing. Step 1 calculation. You have to calculate the achievement points and improvement points for each measure. Step 2, you have to determine the measure or dimension score. And step 3, you calculate the unweighted domain scores. And step 4, you determine the dimension weights. In step 5, you calculate the weighted domain scores. In step 6, you will calculate the total performance score. Incentives and penalties. ASCs report quality of care data for standardized measures to receive full annual update to their ASC annual payment rate, beginning with calendar year payments. ASCs not meeting the reporting requirements or allowing the data to be publicly available may incur a 2.0 percentage point reduction to any payment update provided under the revised ASC payment system for that year. How value-based purchasing impacted the quality of care in the U.S.? Well, it was impacted by reducing costs, increasing patient satisfaction, reducing medical errors, informing patients, and promoting healthy habits. In conclusion, we discussed value-based purchasing and examined the measures for ASCQR and their reporting requirements, payments determinations, step-by-step calculations, incentives, and penalties, as well as how the value-based purchasing impacting healthcare in the United States. That's it.